how do we actually bring health and well-being programs to these communities? And through the mobile health unit, we are able to actually do that.
I think that this is probably a legendary thing for Delaware, to be able to take nursing students and nurse practitioner students and give them the opportunity to come out on the street and provide community care and medical care firsthand. These are folks that we have to give additional support to and be aware of their needs, and take us out of the ivory tower. I don't get a whole lot of information when they come into my world. I get a lot of other information when I come into their world.
It meets the spirit of the UD Partnership for Healthy Communities because it advances that level of student engagement, which expands upon their education scholarship.
As nurses, they typically will go into the institutions and go into the hospitals and take care of sick people there, but it's a whole different world on the street, and community medicine is a lot different. And so you really learn about the social determinants of why people can't get their meds filled or why they're afraid to go to the doctor. And if you're able to be adaptive and understand those things, they'll be a stronger healthcare provider.
Based on what our choices were for our community rotation, I thought that this was the coolest choice, just because we don't usually get to interact with these kind of populations that are people that could just be homeless on the street, or whether they just have no health insurance and no access to health care. So I chose this because I feel like it would be the most educational for me as a whole.
Being in clinical, I think I've learned so much, even more than being in a classroom, because it helps me remember it more. Even I had someone who had the chickenpox on the van, and so now when I think chickenpox, I know what it looks like.
So we go to 9 slots that we're going to go every 2 weeks. So when I see people, I'll say, I'll see you in 2 weeks. So I feel some assurance that the compliance will be better, their understanding of their medical condition will be better, and hopefully their health will be better, because I'm providing them an opportunity to have a medical home where they might not otherwise feel connected. That's sort of our goal.
We are seen now as a clinical setting through our mobile health unit for epidemiologist students as well. And so we'll have 2 graduate students that are joining us, and they really will be having these conversations with the community and collecting the data, so we can look at, not only hearing directly from the community and what they believe their needs are, but also what outcomes are we getting as a result of having the mobile health unit here visiting the many sites in the city of Wilmington.